I'm really excited to see between 400 and 500 people attending this conference. They come from, I think it's 52 countries, and it's quite well represented from Africa, from Asia, South America, Caribbean, North America, Europe. And so it's the largest grouping of alcohol researchers, civil society organizations, government representatives we've ever had in this country. And I think by meeting together, there's going to be very fruitful discussions, and I really believe and hope that it'll be a catalyst for meaningful action at both global, regional, and national levels.
It is the first time that the conference is being held in Africa, where we are plagued with multiple issues that are responsible for the slow implementation of the global strategy to reduce the harmful use of alcohol. 21 of the 47 countries in the WHO African region have alcohol policies, but their enforcement is very weak. There is limited regulation on where and to whom alcohol can be sold, and this is reflected in the prolific sponsorship of sporting events and youth activities. Attempts to restrict marketing are undermined by online advertising. Interference by the alcohol industry in policy development processes is a familiar challenge.
There was a plea from various indigenous peoples for this conference to really open a space and a platform and to make available resources, funding, participation, designing a plan of action where we can start, in community awareness, work together hand in glove.
Unfortunately, the honor to share my thoughts with you all are tinged with sadness because I also happen to be a woman who lives in a country ranked 6th globally in femicide rates. This identity will no doubt jaundice my perspective on how I view the issues that we're talking about today. The conference theme, Investing in People Before Profits, sets the stage for a critical exploration of the nexus between industry interests and building inclusive societies that are firmly rooted in upholding public good.
A legally binding treaty is an appropriate way to support governments wanting to protect their citizens from alcohol harm. This is given the globalized activities of the commercial interests and the global network of trade and investment agreements which support these commercial interests. There is good evidence showing that the presence of the Framework Convention on Tobacco Control has made a difference in protecting tobacco policies in relation to these investment treaties. And we need the same for alcohol.
I hear you, and that is the message. Pass the liquor amendment bill now. That's the message. And from the Department of Social Development and all other government people who are here, take note of what they have brought us here. It's a message, and I think it's a message that is positive. I think it's a message that says to us we must listen when you stand up to talk to us. Thank you very much. Alcohol substance is widely available consumption, and the South African Medical Research Council raised concerning findings that there is a liquor outlet for every 190 persons in South Africa. This is one of our biggest challenges. In fact, what is more disturbing, if you were to look at where exactly are these outlets that we are talking about, most of these outlets are amongst our communities, black community, as a matter of fact.
Taxation is important for alcohol control. First of all, because alcohol is one of the main reasons people is getting sick around the world, and they are dying because of that risk factor. So there is an important burden of disease in societies for alcohol. Second, because we have identified as scientists, as people working in academia doing research, that out of all possible interventions, there are just a few that are very effective in dealing with these kind of problems, and taxes are one of those interventions.
Uganda has been battling an increasing alcohol problem. The alcohol consumption in Uganda is increasing, and yet for the last 2 to 3 decades, Uganda has been ranking very high in alcohol consumption. Right now, Uganda is ranked as the highest alcohol consuming country per capita in Africa, and Uganda is also witnessing a lot of alcohol related problems. Problems to do with road accidents are very high. Alcohol related deaths are very high. 7% of the deaths in Uganda are attributable to alcohol. I look at SEPA as a technical package that can change almost everything around when it comes to alcohol.
Another thing that limits us to have a strong vehicle that speaks around issues of alcohol is that we do not have resources. We collaborate for us to be able to engage on these issues. You know, we don't have resources, and with government, they are not keen to lead the conversation or maybe assist with resources for us to be able to have these engagement sessions.
Digital alcohol marketing has a profound impact, and it has completely revolutionised the nature of alcohol marketing. They also talked about social media, how it can reach younger demographics. What social media can do is that it's opened up a whole new world for alcohol marketers. It's able to target specific groups really effectively, and it's able to boost reach and engagement of alcohol marketing.
There are a few questions that come up to my mind when I hear alcoholic beverages causes cancer. Is it all types of alcohol, of alcoholic beverages? Yes, indeed. In fact, all types of alcoholic beverages and alcohol, as in also unrecorded and home-brewed alcohol. All these beverages can cause cancer. And what causes cancer is in the alcohol is the ethanol, the main constituent of alcohol, and one unit of measure of consumption corresponds to 10 to 12 grams of pure alcohol. So one drink, you see the different size of the glasses, corresponds to 10 to 12 grams of pure alcohol. Is considered one unit of measure of drinking.
We said in the title of the conference, we said building the momentum for a framework on alcohol control. It's a long process, there's no doubt about it. It doesn't happen in overnight. And the speed with which it happens will depend on the work of the advocates here, and it will depend on whether member states of WHO are prepared to pick it up and make it happen. And it will be particularly the countries, the middle-income countries, which are currently the targets of the alcohol industry to increase their profits. It will really be up to whether or not they decide to try and withstand the pressures from other countries and the alcohol exporting countries, for example, and really try to move it forward. So I think we are in my sense is that we've got more momentum than we've ever had before. There are more calls, people are talking about it more openly, but we still depend on countries, governments, ministries of health, persuading other elements within their governments that this is a necessity to protect the health of their citizens for it to happen. But it's possible.
Medium-term goals, this is where I think, please point out things I missed, but I think an important goal is the denormalization of alcohol use in society. And that was said at the report back by colleagues from the European region, by Florence, and also by Shanae from the indigenous, representing the indigenous grouping in that report back. Secondly, goals for government. No, you can't. Okay. Quick. Goals for government. Establish clear rules on how they're going to engage with the liquor industry. Governments also need to reduce the scope of lawful industry influence on alcohol policy. And someone, Sarah, the colleague from Uganda, I didn't get her last name, we need to draw a line in the sand in terms of alcohol industry involvements in health and health policy. The WHO, a goal for WHO, is to better manage industry conflicts of interest. And this is an important goal that they need to do before we even consider moving towards a framework convention on alcohol control. At the UN level, Christina said, I think on the first day of the side meeting, we need to consider a high-level meeting on alcohol in New York before the global alcohol action plan ends in 2030.
We, the 520 participants from 55 countries, gathered at the 7th Global Alcohol Policy Conference in Cape Town, South Africa, from October 24 to 26, 2023, recognizing alcohol's significant role in the global burden of disease and as a major barrier to achievement of the Sustainable Development Goals, call on our national governments to recognize the alcohol industry's conflict of interest with effective alcohol policies and establish clear rules separating the industry from engagement with policy development. And we call on WHO member states to direct the WHO Director General and other intergovernmental organizations to study the necessity and feasibility of a legally binding instrument to strengthen the public health response to alcohol consumption and related harm through consultation with nation states and civil society, and to report the findings through the Executive Board to the World Health Assembly. My friends, can we adopt this by acclamation? Thank you so much.